Welcome to Community Taking Action, ABCD's program highlighting people and agencies that are doing work in and around Boston. My name is Eric Mitchell and I'm your host. And today we'll be joined by Dr. Charles Carter from the Crittenton Women's Union, also known as Chuck. Thank you for joining us.
Pleasure to be here.
If we just start our conversation on how you came to your position at Crittenton Women's Union.
I had the opportunity to come to a program in New Hampshire for emotionally behaviorally disturbed kids. I was on the track to do psychology and found the field of social work, and really was impressed with the commitment to social justice, which I hadn't really seen in the work that I've been doing before. And so shift gears when I was done with my undergraduate degree to go on to get a master's. And that same organization that introduced me to the work in New Hampshire offered me a job up here. And about that point in my life, I had finished my doctorate and was trying to figure out my next step. You know, where could I have the most impact somewhere? And Crittenton position came up, and I was really drawn by the mission, the population, and the opportunity to do something different than what I'd been doing in the past, that I could measure the impact there.
Certainly. So what is it? Talk a little bit about, you know, that role, the role that you now find yourself in, and all of the things that you just mentioned, you know, the role, the impact, you know, just the scope of the things that you're doing.
I oversee the programs. I oversee our research and innovation department, our facilities department, our food services, our case management, and our human resources. And
how long have you been in the position?
I've been there a little over 5.5 years.
Okay, so you're just now getting your feet wet.
Just getting used to it, yeah. But it's been a powerful experience for me. We go about the work a little differently. One of the things I tell people is that the mission for me stands out. So it meant for us, we had to do our work differently. And we had to find a way to figure out, if we're going to transform their lives, what does economic independence look like? How do we define that? So with our research agenda, we're able to look at how much does it cost to live in Massachusetts without safety net benefits? And we do that by the number of people in your family and by where you live. And so we say, here's our mark. We're going to go from folks who are unemployed, underemployed, low wages, to getting to a salary of about $65,000 if you're a single parent with 2 kids, one who's preschool and one who is school age.
Is that the number?
That's the number.
Okay.
And so then the question is, well, how do you do that? How do you get folks from there? Because we do have programming. We have housing, we have mobility services, we have workforce development, we have healthy families. But those things by themselves won't get you to self-sufficiency. So we have been trying to be innovative and creative about the types of programs that we develop. We have a theory of change that we developed, call it the bridge to self-sufficiency. It's actually
talk a little bit about that.
So it's actually a bridge. It's a visual of a bridge. It has 5 pillars. The pillars are family stability, well-being, education and training, financial management, and career management. And under each one of those, there's a couple of variables. So under family stability, it covers housing and your dependent needs. Under well-being, it covers social networks and your health, both physical and behavioral health. And you have the education and the finance. Finance has both assets and debts, and then the career. And so what we say to folks is that when you're trying to move from low income to that salary that I was telling you about, you have to work in all 5 areas.
Do you help them to kind of map a way off of whatever benefits programs they might currently be receiving?
We do. It's not a place that we start. We start with what's the outcome? Where do you want to go? What career do you want to be in? One of our programs where we collaborate with the Cambridge Housing Authority, one of the goals out of that is that the families will eventually be able to release their housing voucher so that they're doing market rate units.
And you actually get people to do that?
We haven't gotten there yet,
that's a huge leap.
It's a huge one. But actually in our pilot program in South Boston, this is called the CFO program, it's Career Family Opportunity Program. I know we'll talk about this a little bit later.
Sure.
But we've had 3 families buy homes, and these were families who were in public housing.
It's daunting to think about going from one to the other, but it's good to know there's examples.
It is. You know, one of the things we talk about is everybody's got dreams about where they want to go. And what we try to do is break those dreams down into bite-sized pieces where we can say, you know, here's a step that you can go in, and let's think about how to keep that moving and how do we measure it.
And so if you could just talk a little bit about, you know, the role, the niche that not just you, but the organization plays in the community and in the context of helping families really get out of poverty.
One of the things that's been different about what I do at CWU is that we have both direct service programs, we have the research, and we have the advocacy all in-house. How do we help our staff, give them the voice to say, you know, you're working with the clients firsthand. Tell us what you think makes a difference. And use their energy, use their ideas to help share that across the organization. Whether it worked or it didn't work, because if it didn't work, that's great. We'll learn something else. We'll figure out how to tweak that and be able to move forward. And then that informs what we want to do on the policy side. So a good example for me is that one of the things that we saw a lot of with our families were folks coming in with a lot of educational debt without a degree.
Wow.
The moms would come in going to schools. There were more of the for-profit types of schools where they spent a lot of money to go there, but then for one reason or another couldn't finish, and they then had this debt, and they had a hard time going back to school because they had this debt. So we were able to partner with a law firm to help those moms be able to get some counseling around how do I think about addressing this debt, because you know it gets fearful when it gets so large. You just think,
That's
you
right.
know, I just won't let it go. If I don't think about it, maybe it goes away, but you know it doesn't, and it becomes a huge barrier. But it also made us think about how we start talking to families about when you're going back to school, what do you think about? What types of schools will give you the best benefit? What are their graduation rates? What are their costs? What's going to be the cost for you? What do you get out of that in terms of being able to move forward towards that career that's going to pay you those family-sustaining wages?
How does someone looking for service reach out and get the information that they need from Crittenton? What's the number or the person?
So you can go to our website, www.liveworkthrive.org. Our shelter work is referred through DHCD. We've got a conference coming up in 2014 that helps move the conversation forward around how to help folks get out of poverty and be economically self-sufficient.
Excellent. I look forward to that. I think I will join you there myself.
Great.
Thank you for joining us. This is Eric Mitchell. I'm your host with Community Taking Action. We look forward to seeing you next time.